Hey everybody, I'm back with my now good friend, Dr. Justin Dubin. He is a fellowship-trained urologist and andrologist focusing on men's health. He cares for fertility problems, sexual issues, low testosterone, testicular pain, and basically anything that penis owners and testicle owners can come up with. He's back in Florida because he just completed his fellowship, and now he's a full-blown, full-time practicing urologist.
A real doctor. Yeah.
You're a real doctor. Welcome. And a reminder to everybody, this is not, we're not practicing medicine on this podcast. This is for education and entertainment purposes only, which I love saying. But we're going to talk all things men and penis owners today. So thank you so much for joining me.
Kelly, thank you so much for having me. This is so awesome. I'm a big fan of you. I'm a big fan of this podcast and what you do. Obviously, we were talking about it before we went live, but this is awesome. I'm really excited to be talking with you today.
Oh, I'm so excited that you're here. And you have your own podcast, Man Up, A Doctor's Guide to Men's Health, which you do with another urologist. So we're like tripling the amount of urologist podcasters in the world, which is awesome.
And we need more. And we need more. You're right.
We need more.
Absolutely. We're all here to help
listening.
People. And what's great is that, we were talking about it. You talk about very sensitive issues that people don't want to talk about. And that's what also spurred our podcast, because as we'll be discussing, a lot of men don't want to talk about their sexual health problems, although they are definitely more discussed in general than female sexual health problems. And that's why what you're doing is so great, because you're really normalizing the conversation and destigmatizing it and making sure that people, understand that there are things that we can do for you as long as you come in and talk about them.
Totally. Yeah. And a lot of people who listen to my podcast listen with their male partners and talk about it. So that's why I really love bringing on, not only because we need to represent everybody on the podcast, but because it really helps people start talking to each other about their issues. So everybody needs to know about men's health.
For sure.
So why don't men go to the doctor?
So I think it's a few things really, but I think the big one is really that there is a stigma of masculinity, I think, when I think of my patients. And I think when you picture this manly man that guys like to think of, you think of a strong guy, jacked muscles, great energy, outstanding libido, who's great in the bedroom. He's got, a lot of kids, great family. And then all of these things are really things that guys associate with being a man. And when we're talking about men and men's health, all of those things are usually the problems that guys can deal with, right? Erectile dysfunction, low energy, they're gaining weight, they have obesity, they're losing muscle mass. So, a lot of things I think that men picture as what they picture a guy to be are the things that they don't want to admit that they have problems with. So I think it's very hard for guys to discuss this. And we actually have some data to support this. There was a paper out of Northwestern by one of my mentors when I was training there, Dr. Halpern, Josh Halpern. He showed that about 30% of men who were concerned about their fertility were likely to discuss their concerns with the doctor. So only 30% of guys who are worried were actually seeing anything for anyone. And I think there's another component to it too. I think that guys, we like to try to figure things out on our own before we get help. And the analogy I usually use in my office is, I say, all right, when I go to IKEA and I buy that furniture, I'm not reading the directions. I'm going to try and figure this shit out. And then after about 2 hours of not being able to figure it out, yelling at myself and getting frustrated, then I'm going to go to the directions. I'm never going to ask anyone for help until I am really struggling and I realize that I do truly need help. So I think that there is another level of it where, it comes to this idea of, I'm going to fix myself. I can do this. And, I'm the man, I'm the guy, I can do this. I don't need anyone, but you do. And sometimes it takes a little longer for guys to figure that out.
Totally. There's data for women that women wait on average 7 years before seeing a doctor for bladder leakage. Bladder leakage, maybe prolapse. 7 years.
So long. That's really long.
Yeah. And I would say in my practice, it's 13 years, right? To move the needle. And in the sex world, people on average, when they see me, they stopped having sex about 7 years ago. 13 years ago, 5 years ago. Is there any similar data on men and like low testosterone or erectile dysfunction on like how long they wait before they go see a doctor?
That's a great question. I'm not really sure. I mean, just anecdotally, it's definitely not even close to as long as that. I think a lot of guys, depending on the age, a lot of guys, I mean, I see guys who get a prostatectomy, and if they're not having sex in 6 months, they're losing their mind, and we know that that's a potential risk factor for erectile dysfunction. I do see guys, a year, where sometimes these younger guys, if they can't get it up once, they're coming to see me right away. So there is a different, I think, dynamic and time frame based off of age differentiation for sure within my population.
Yeah, like you almost see the opposite of like, dude, it's my penis. Like, I think I saw a wrinkle on it or something. I need to get in and get it checked. Like,
that's correct.
Like
there are some people like that. Yes, there are some people like that. And I appreciate it though, because it still gives me an opportunity to have them come in, to educate them on their sexual health, their other health problems, and address whatever concerns they may have, really.
So where do you, in your experience, or maybe there's data on this, where do men get most of their sex ed from? Are they getting it from porn? Are they getting it from an older brother? Like their first lover when they were 17? Like where do most guys get sex ed from?
I think at this point, I think there was a time, and I was part of that age where, I remember going to middle school when I turned 13 with my dad. They had father-son night. They had mother-daughter night. I have no idea if they still do that, where we would learn about puberty and sexual education. But I think those ways have kind of gone with the times. I think, like everyone, I think guys really prefer to do their own research, and they get all their information online, whether it's through porn. I don't know the statistics there, but I do know that 72% of adults use the internet for researching health information. And there's been a 40 to 70% increase in users seeking information via digital content since the start of the pandemic. And, there was a new study that recently came out showing that about 1/3 of Gen Zers, it's a newer term for me, consult TikTok for health advice, and another 44% turn to YouTube before going to their doctor. And then in that same survey, they showed that about 20% of Americans, that's 1 in 5, reportedly consult TikTok before their doctor, well, when seeking treatment for a health condition. And they also, 20%, really say they trust health influencers more than their medical professionals in their community. So, I think more than. So wow. It's really one of those things where I think in the last 2 years since the pandemic, with everything that we've gone through, I think more and more people are going online for their health information through TikTok, Instagram, YouTube. And it goes back to this idea of embarrassment, especially when it comes to sex. That study also showed about 17% said that they would turn to influencers online to avoid judgment from medical professionals. So they're embarrassed. And it goes back to what we were talking about before, why guys didn't want to come in the first place, because they feel like there's some kind of judgment being done. And I don't really know where that came from. I kind of was shocked when I read that, because I think the one thing that we definitely learned about in med school is really show no judgment and be very, very open and honest. Now, and I obviously know that we are both physicians who definitely practice that and keep that close to our hearts for sure.
Yeah, I had you get to the point where you've been doing this long enough. Like a guy came in and he's like, I don't want to tell you because, and I was like, at this point in my career, I've heard it all. And if I haven't, like, please tell me, because like, I'd like to keep hearing it all, because it's repetitive at some point. And so he told me, and I'm like, oh yeah, that happens to lots of dudes. And he's like, really? And it's
I think that's such a great point. I think that's such a great point, because every day it's a guy who's like, I don't know if you've ever seen this before, but I've seen it. I would say 99% of the time. And I usually tell my patients, I'm not trying to be mean. I'm not trying to be like, but this is good. You're not special in this situation. I've seen this many times. And because I've seen it so many times, I know how we can fix it. We all know how to fix this. I know that it is embarrassing to talk about, but because you're here right now, we can talk about it and we can figure out a way to meet whatever goal you have, whether it's sexually, energy, erection, anything, we can figure it out together.
That's awesome. One thing I see a lot when I talk to men is their lack of education in like the difference between libido, erections, orgasm, and ejaculation.
Yeah.
And them all kind of thinking it's the same thing. And like as a doctor, you really got to hone in, like, is this a libido problem? Is it an erection problem? Is it an ejaculation problem? And like they don't know the difference between all of that. You see that too.
Yeah, and I think that some of it there is overlap with understanding what is the cause, the root cause of it, but it is very important, when I'm getting a history from someone, that I'm really eliciting those specific things and I'm asking specific questions to kind of figure that out. And when we're talking about erections, I think some of the easiest things you can do is just, sometimes I'll just say in the simplest of the terms, like scale of 1 to 10, 10 being the hardest erection, 7 being able to penetrate. Tell me on average, without any medications, where you think you are. And then, and that's kind of a very simple way of breaking down like where you are, and then where do you want to be? Or if you take a medication, if you take Viagra, can you get from that 6 where you can't penetrate to an 8? And so you can kind of understand that part. And then I think when you're talking about things like ejaculation, a lot of guys come in, and I think one of your points is really that I found out a lot during my training, and especially during my fellowship, was a lot of guys come in and they say that they don't last long enough, and the concern is premature ejaculation. And then when you kind of elicit what that means, you say, well, how long are you lasting? How long were you lasting before? Was it always this way? And they say, well, I'm 60 years old. I'm not lasting 20 minutes anymore. I'm lasting about 7 minutes. I'm like, that's pretty good. And you kind of have to put it in relation, but there's other things, right? Some guys say, when they say they're not lasting enough, they're actually talking about the refractory time, the ejaculatory refractory time. So they go, yeah, I have sex, I orgasm, and it takes me 3 hours to get back into it again, to get it up again. And that is obviously a different problem from, premature ejaculation, delayed ejaculation. So, and counseling patients appropriately is important. When you're talking about orgasm, obviously orgasm is a component. When we're talking about ejaculation, we're really talking about, the semen or fluids leaving your penis. But when we're talking about orgasm, there's more involved. There's like a mental component. There's a physical component. Orgasm is really associated with, there are muscle contractions, the bulbospongiosus muscle and around your urethra, your pelvic contractions, just similar to a female who has pelvic contractions, I believe, with orgasm as well. And there's also this associated release of oxytocin, prolactin, hyperventilation, facial grooming, which you can have without ejaculating, and you can ejaculate without orgasming, and you don't have to have an erection to technically orgasm or ejaculate either. So you're right. There's a lot of different levels at it. And I do have guys who have flaccid penises who are able to orgasm and ejaculate with their partners and are happy with it. And they don't want to do anything, because as long as they're happy. So there are a lot of different components here that you kind of do have to elicit. And it's funny because a lot of people, especially guys, and sometimes their partners, think that we are that simple. We're simple little animals. We either get it up, we don't, we come, we don't. But that's not necessarily the truth.
Yeah, there's so much different plumbing and hardware, and oh, by the way, the brain's involved, which I didn't really get that in the urology training, in residency. And
Right.
I was like, the penis is involved, and when we have Viagra, so there's no longer a problem. And then I got out and I got into female sex med, and I was like, the sex therapist would tend to disagree with the urologists on this. Like, there's, the biopsychosocial, and how's your relationship, and do you have anxiety about sex, right? And the role that anxiety plays on penile function.
Oh my God. So when I talk with patients about erections and erectile dysfunction, I kind of break it down into, you need 5 things to get a good erection. 1, you need good blood flow to your penis. So obviously if you have heart disease, things like that, like vascular diseases, that can compromise that potentially. And we know that erectile dysfunction is an early sign for cardiovascular disease as well. Two, you need good nerves, and that can be compromised through things like a prostatectomy, or if you have diabetes. So, a great way to counsel guys who, maybe don't have erectile dysfunction yet, who are newly diabetic. You say, hey, listen, man, if you want to keep your erection, you got to get your sugars under control. Three, you need good testosterone levels. So, that comes back into touch with, and that's why, erectile dysfunction, low desire, they do have an overlap with low testosterone. So I always consider getting a testosterone level if a guy comes in with ED. In fact, I usually do, per our AUA guidelines, kind of recommends that. And then the other two kind of go to your anxiety and the mental health aspect. The first one is you have to be attracted to or aroused. So, obviously there is a component with your relationship with your partner. If you're not aroused or attracted to your partner, whether it is a physical thing, emotional thing, relationship, there's always an issue there. And then the last thing is, you have to be in the right state of mind. Anxiety, depression, you're not going to really be able to get a good erection. And the other thing that people don't know, unfortunately, sometimes the medications that treat anxiety and depression can also compromise your erection. But when it comes to anxiety and depression, I use the Robin Williams quote when I'm talking with my patients. I say, so Robin Williams had this awesome quote. He said, God gave man a brain and a penis and only enough blood to control one at a time. And it's very, very true. Because if you are in your head, you're anxious, and I see this with a lot of young guys, you're anxious, you're worried about performing, guess what? You're not going to be able to perform. So, there is a huge biopsychosocial component for erections and sexual function in general. So you're 100% right.
Totally. Is for testosterone in men and libido, are there a range of like, hey, I like to get guys like above 400, or is there not really a cutoff for libido specifically? Or erections? Well, same question, erections.
So, how we define a low testosterone by the American Urological Association guidelines is a level less than 300. So you have to have a level less than 300, and you have to have signs and symptoms of testosterone deficiency. Now, this can be, things we talked about: erectile dysfunction, low libido, low energy, issues with focus, decreased muscle mass, decreased body hair, not head hair, body hair, gynecomastia. And these are all signs and symptoms. If you have a combination of those, of the levels and the symptoms, you can be considered to have testosterone deficiency. And when we're treating you for testosterone deficiency, there's a lot of different options, but the most common one is testosterone replacement therapy. Usually it's an injection or a gel. There's a subcutaneous pellet. There's also now oral pills that have just come back onto the market. So there's a lot of different ways that, we can treat you for testosterone deficiency in a manner that, you're comfortable with. And when we're trying to treat your testosterone deficiency, our goal is around 450 to 600 is our goal. And that's kind of where we're sitting. And obviously, what I usually do is after I start someone on this, I see them after about a month on the medication, see how they're doing, see how they're feeling. It can take up to 2 to 3 months for guys. And I counsel them saying, you're not going to feel amazing right away necessarily. It can take some time, but around that 450 to 600 range is where we really like to see guys sitting when they're on testosterone replacement therapy.
Awesome. I love that. Yeah, I know there's some newer talk about a higher normal level for the younger a man is. So it'll be interesting to see at some point if the guidelines will shift to an age-based testosterone range or where we're going to go with that.
I think it should eventually go that way, because there's no way that, if you just think about it logically, and obviously the data is just starting to come out. I think Dr. Jim Hoteling just put out a paper recently, earlier this year. He's at Utah, I think, and he showed that there is a difference in testosterone levels on average between, different age groups. And, what an ideal testosterone for a 70-year-old man is probably not going to be the ideal testosterone level for a 25-year-old guy who's suffering from, low testosterone. But the other thing, there's other differences there is, the 25-year-old guy, I might not put on testosterone replacement therapy, because one of the biggest things that guys need to know and understand is that, testosterone therapy, while good for a lot of people, and it's a great medication, and I prescribe it all the time, is really not for everyone necessarily, and there's things you have to consider. And the biggest one is really fertility. What guys don't know is that, taking testosterone can cause infertility. And really being in South Florida and practicing here and doing my residency here, I saw it all the time. Saw young guys taking testosterone when they were younger, coming in with their partner, and they're still on testosterone, and they're having issues with fertility. They can't figure out why they're having a kid. And I get a semen analysis and they have 0 sperm. We stop the testosterone, and, sometimes it comes back, sometimes it doesn't. But the data shows about 60% of men on testosterone replacement therapy develop azoospermia, which is no sperm in their ejaculate. The good news, though, is if you do decide to stop, at about the 2-year mark, most guys get return of sperm to their ejaculate. But even when they do, we do have some baselines, studies showing, before testosterone and then coming back, taking testosterone and then coming back off of it, most of those guys only achieve about 85% of the levels of their semen quality or sperm numbers prior to their original testosterone usage. So, these are important things to consider for sure. And there's other medications like Clomid HCG that we can talk about, or I can talk about with the patient, to increase their testosterone naturally and not compromise their fertility.
That's awesome. That's super. Thank you for explaining that. The thing I'm curious about, and I see let's say he's 42, maybe he's a night shift worker, so his sleep's off, he's drinking some alcohol, he's having a super crappy diet, he's super stressed. So all the things that we know lower testosterone, and you say, hey, if you change your lifestyle, you can get your testosterone up, right? So this isn't somebody who's born with a congenital low hormones or anything. What's the fear of, if, let's say he doesn't do that, he just wants a quick fix, doc, give me the testosterone. What's the fear that you can never get off of it because your testicles will never start making testosterone? Am I saying that right? My fear is don't get on it if you can get there naturally, because are you going to be you're looking at a 60-year time frame on testosterone. What are your thoughts on that?
I think it's an interesting perspective, and I do hear that a lot from patients, like, hey, am I going to be on this forever? How am I going to deal with this? But just to go back to your original, the guy who we're talking about, one thing that is very cool about low testosterone, especially, is that you can modify your levels and improve your levels by some lifestyle things: eating healthy, losing weight, getting your sugars under control if you're diabetic, exercise. These things can boost your testosterone. But at the same time, I don't necessarily agree with telling guys to just change their lifestyle, because here's the thing. You're coming to me with a problem. You have low testosterone, you have low energy, your motivation is not great. It's hard. You're stuck in a loop sometimes where you want to, but you don't have the energy to go to the gym. You don't have the energy or the focus or the willpower to really get that diet going. And a lot of guys,
you're not seeing any results.
You're not seeing results. So you need that testosterone boost to actually help you get to that goal. So it's kind of like one of those things where I don't necessarily believe that the answer is always lose weight and eat healthy, because listen, I'm always going to push that. Sometimes it is, and sometimes you have to have that conversation with the patient, but sometimes it's, hey, listen, we're going to put you on testosterone. I know you're trying. This is going to hopefully help you get over that hump and really get to a place where you want to be, where you're exercising more. You feel like you're going to be losing weight more, which you probably will. You're going to get more muscle mass. So it does help in that way. Going back to the part where you're saying, is it forever? I think for the most part, yeah, I think it is a permanent thing. Is it permanent in the sense, if you stop, are you doomed? Or no, I mean, but I do think that once guys are on it, the only time I usually recommend stopping, and this is in our guidelines, is if you put them on testosterone and guys don't feel better. if guys are not feeling better within a, 6 to 8 month year time, maybe it's not the low testosterone that is causing their issues. And maybe you can talk about it with the patient about considering stopping it. I will tell you in general, I think we do a very good job of, screening out the people who might have other issues going on. Yeah, I think, it can be a scary idea of being on something forever. But at the same time, I think the scarier idea is not being you, not feeling good, not having energy, not having the sex life you want forever. And if you had to choose one or the other, I'm probably going to choose the one where I'm taking a medication to make me really live my best life and making sure that I can do what I need to do. And like I said, you can always come off of it. Are your testosterone levels going to be high? Probably not. You're probably going to be at best the levels you were before you started, at best. But that's also the choice you're able to have. I'm never going to force someone to stay on it forever.
I love that. And I love just pointing out, I mean, people who listen to this podcast all the time will see that of like, I always say how we treat women is different than how we treat men. Right. And like the conversation of like, hey, your quality of life matters. Your energy matters. Your sex life matters. Like what we tell women, and I'm stereotyping the nation, but like, right. Well, these hormones, like, you're going to have to be on them forever. And like, women really get shamed into thinking quality of life does not matter for them. Or like you're just gonna have to keep taking this forever, And they're like, well, I guess I don't want to take something forever. Like it's just framed so different, than the way you frame it. I'm like, of course, that's how we talk to men. We're like, your life, your life matters, right? And it's just interesting when I see, women and hormones. It's really framed in a different way. It's crazy.
It's a very interesting observation. Obviously, I'm a men's health specialist, so I usually, unless it's like a kidney stone or something, I usually don't really work with many female patients anymore. But it's an important thing to hear and understand, because I think that, I think we all can do better. I think it doesn't matter, we can all do better and think about it from that perspective. So I appreciate that.
One thing that's super interesting in my interest in female sexual function, in that about 30% of women will have an orgasm by penis and vagina penetrative intercourse, and that's usually because the clitoris is stimulated, right? And again, we can't say clitoris, but it's the clitoris is the penis, right? And so I started seeing guys will come to see me for erectile dysfunction, and I had this amazing kind of round table with urologists. I'd love to get you in on this, because I was trained like, you treat the guy, he's here for erectile dysfunction, right? And another argument would be like, you treat the couple, right? He's going to take this newly erected, Viagra super penis home and maybe have never talked to this person, and is going to change her life. And again, I'm stereotyping a heterosexual couple here for illustrative purposes. But so some urologists will be like, you're treating the couple. Has he even talked to her that he's going to bring home a super penis now? Right. And is that important? Is that important as a physician to care about that? Right. And it was awesome. Like, this would be an awesome, like, counter table or whatever at some urology thing of like, yeah, because the people who bring the Viagra back to our clinic, because he never talked to her about it. And now he wants, or maybe he got started on testosterone. Now he wants sex 4 times a week. Never talked to her about it. And so I think, amongst sexual issues in couples, it's this lack of communication. It's not like the body parts that are the problem. It's this lack of communication. And like, honey, I'm going to the doctor to talk about how I can have more desire and better erections. Are you interested in that with me? Right? Like, that's the part that never happens. And I just wonder the role of the physician, because you're going to get the physician who's like, who cares? He's my patient. And then you're going to get the physician who's like, well, he's going to want to put the penis in the vagina. Like, are we trying to optimize the situation for him, or are we not going to help him with that part? And it's actually, that's his goal, though. Like, what's your take on this?
You have a really unique opportunity, though, because you can see both patients, because I don't really see the female aspect there, but you could technically treat the guy and you could treat the female, and you can have them both in that room at the same time. I mean, just from my experiences, I usually ask who their partner is. Like, the first thing, like, whenever I do like my first initial visit. I ask if they're sexually active. I ask if they have a partner. I ask if they're married, single, relationship, whatever it is, just so I have an understanding. They're interested in men, women, both. I ask every patient those questions just so I know kind of what I'm dealing with, how old they are, how long they've been in a relationship. It's just important, exactly the stuff that you're saying. And I have seen patients more and more, men talking to me about, how their female partner is actually having some discomfort with sexual intercourse. So I have seen that more in the last year and a half, really. So I don't know what's changing. I hope it's changing. I hope people are being more considerate and thinking about these things. So that's good. But yeah, you're right. It is something that there's like a missing piece there that we really are not identifying enough of, especially when we're doing things like penile implants and stuff like that. And it's always important to try to incorporate the partner. But the problem is, you have to respect your patient's privacy. Some guys don't want their partner to know that they get a penile implant or things like that. So, there's a whole complexity there. But in general, I think the idea of sex for men, we have to do a better job of, because I think you're right. Most guys think of sex as penetrative intercourse. And the truth is that that's not the only kind of sex that exists. And it's kind of hard for guys to get that. But one thing that I always tell my patients, especially those struggling with erectile dysfunction, is like, hey, in the moment, if you're not able to get it up, that's okay. There's other kinds of intercourse you can participate in, and, it's oral. You can use your hands. There's petting. There's the outer course, all this kind of stuff. And I think it's very important that we do a better job of educating men on that. And the other aspect of that is that I think that men don't understand that sex doesn't always end when you ejaculate, right? The female partner also is still there, and they may not have orgasmed yet. And just because you're done doesn't mean that the whole experience is done. And I think it's a communication thing. It's an important thing that we can educate our patients with. So I've really found that as a big thing to stress over the last few years with my patients, especially the guys who have erectile dysfunction, even the younger guys who say, I'm in the moment, I lose it. Just go do something else. Keep doing something with them and you'll get it back probably, because you're not focusing on yourself. So there's it's a really important point that I think we really need to continuously stress to men out there.
I think so. And I think, even when I did residency, not learning at all about this, and like, Viagra doesn't work in everybody, right?
Correct.
And I would say erections aren't the goal. Like, there are plenty of vagina owners who are like, I would love to spend some time with you, and it doesn't even need to have an erect penis involved putting in my vagina, and I'm going to have
Absolutely.
a ball, right? And like, that perspective's missing. And then that a man can have a satisfying sexual life with orgasms without having a hard penis. And I'm like, where's the book? Where's the education tool? Like, where can I send that guy? Because they don't know how, right? But like, I know it's possible because I have patients who say, oh yeah, we do hands and we do mouth and whatever we do. And I have an orgasm, but I don't have an erect penis. And I'm like, that is so shrouded that people don't know that that's possible.
Yeah. I mean, I have a
Do you have
good
any
sex
resources?
therapist. Yeah. I have a great sex therapist in South Florida, Dr. Lisa Paz. She's been on my podcast a couple of times. She is awesome. She's amazing. So she's a good friend of mine. She's in South Florida, but I think she does telemedicine now, but she's a really wonderful resource. I do send often my patients to her for these kind of issues. And she's great with like the biofeedback and all of these educational tools, different strategies, different ways to get people off based off of what they're working with. And so shout out to her. She's great.
That's awesome. That's awesome. Do you know of any book?
There was a book. I'm trying to look it up now. I bought it. I'm just trying to find it. If you give me a second.
That's fine.
I'm looking at my Kindle right now. It has
Purchase history.
Yeah, I'm just going here.
I remember I had about an hour of sex ed in med school, and they actually talked about it at that point of like men learning how to have good sex, pleasurable sex, orgasmic sex without having an erection. I guess I had a very progressive med school.
That's
back
pretty
in the
good. I
day.
mean, that's
It's
pretty
good.
impressive. Oh man, I'm looking for it. I don't. Oh yeah,
That's
Come
okay.
as You Are. Come as You Are. Have you read that?
Come as right. That's Emily Nagoski. She has
Yeah,
a,
yeah.
okay. Well, that's
I
more
didn't
low
read all of it.
desire.
Yeah,
It's an
but
excellent book, but that's more female low desire. I'm looking for like
yeah,
how a man has an orgasm without an erect penis. Justin, I think you
that
have
I
a
don't
book to write.
have.
You have
That
a
I
book to
gotta
write.
read. I mean, yeah, I'm down.
It'd be great to have like what percentage of men with erectile dysfunction does the Viagra and the Viagra cousins not work for?
Ooh, I actually I don't know that number at all. I don't know if there is a number. Maybe it exists, but I would say there's a lot of
30?
different factors.
30%? I don't know.
Do you have a number? Do you know?
Somebody has no. I don't have a number, but somebody has statistics on, and this was a sex therapist. Somebody has statistics on the amount of Viagra prescriptions that are never refilled. There is data on that,
Interesting.
and it's quite high.
Well, I mean,
And I think
listen, erectile dysfunction. There was, so erectile dysfunction is by far the most common, issue sexual health issue that men deal with. It's said about 50% of men have erectile dysfunction at some point. But the general rules is about 40% of men in their 40s, 50% of men in their 50s, 60% in their 60s, 70% in their 70s. But no pun intended, erectile dysfunction is actually on the rise in younger people. There's been data suggesting as high as 30% of men under the age of 40 also have erectile dysfunction.
Correlated with the increase. Is it correlated with the increase of anxiety and mood disorders or health status in general? Or I'm watching porn
it's a
and I don't match
controversial
up?
topic. Yeah, it's a controversial topic. Some people want to blame porn. Some people want to blame mental health. I think some people want to blame obesity and poor diets and lack of exercise. I think it's probably a combination of all of these things. And I think that there's individual situations. What I was alluding to, though, is that lack of refill is a lot of the younger guys who come in to see me, it's usually an anxiety component. They have a bad night, they can't get it up, and they come in freaking out, thinking, is this the end of their erections? Are they doomed forever? And, you provide them with reassurance. You give them a couple Viagra or a Cialis and you say, hey, try this. It gets their confidence back and boom, they stop using it. You never see them again. And that's a very common thing that we deal with. But I think it's also important for those younger guys and any guy really to understand that when you have erectile dysfunction, and we talk about, satisfying your partner even with erectile dysfunction, but how you react in the moment is actually very, very important. And, I didn't really think about this until when I was doing my training. I was with, you have friends and people started coming up to me, women saying, my partner, like young women, they were like, my ex-boyfriend had erectile dysfunction. He blamed it on me. And they're like, is it my fault? And I was like, no, of course not. Unless you're doing something crazy, it's not really your fault. There's no way. And I started hearing that question enough that we ended up doing a study. And what we did is we surveyed over 13,000 women from over 130 different countries. And we had them complete a survey seeing whether they were getting blamed, like how often they were getting blamed for erections, or were they getting blamed for erections, or how did they experience guys with erectile dysfunction and how that impacted their overall health. And what we found was about 80% of women of the 13,000 had experienced at least one male partner lose their erections during sexual activity. And more concerning, though, is that 1 out of 7 women were blamed by their male partner for their erectile dysfunction, which is very problematic. And women older than 40 experience both blame and erectile dysfunction experiences, which is less surprising, that part obviously, with their partner more. But what was more concerning was that the women that were blamed for their partner's erectile dysfunction, they were more likely to end a sexual encounter. They felt a stronger sense of responsibility, of worry. They were less sexually satisfied, and they were more likely to end a relationship due to their partner's ED. So, what does this mean? It means that, guys, like we have to be conscious of what we're doing, right? Even in a bad situation for yourself, you can't really, project those insecurities. It's not a great situation, but how you react in the moment is just as important to your satisfaction as to your partner's satisfaction and the relationship as a whole. And that's where communication comes in. Sometimes it's just not your day, and that's okay as long as you're communicating in an appropriate manner.
This is so like this needs to be on like Good Morning America. This paper, like it is a huge amount, and I see that I see it all the time. And the other thing I see a lot, and again, whenever I gender stereotype, I like to acknowledge like we're gender stereotyping, and this is everybody's different,
Yeah.
but the woman makes the erectile dysfunction mean something about her. I'm unattractive.
Correct.
He must be cheating on me. I'm not good in bed. She always personalizes it. All the time.
But we all do, right? Because I think that's inherently human, right? And I think when guys do it, when the guys blame, my assumption is because of, we all understand sex is a very intimate thing, right? Like, it's a very personal experience. And especially in a relationship, it's a very important thing for a lot of people in a relationship. And if you're not able to perform as a man, you're like this masculine identity comes back into play potentially. And you kind of just have this insecurity and you're worried. So, it's not my fault. It can't be my fault. And you end up blaming it. It's actually the worst thing you can do for the relationship and for your partner's confidence. And at the end of the day, it's really how you interact with the person. At the same time, though, when we published that paper, one interesting feedback that I did get from a couple people, because I engage with people online all the time. I always like to hear people's opinions, was that some guys said, it's not always that experience. Sometimes guys felt that the partner would laugh at them or mock them or things like that. So it does go both ways, of course. It goes both ways. Obviously, I did not survey that part. I've never done a study on that, and I'm sure we can do that. It's probably not hard, but obviously male blame is very important. We should not be doing that. But I do think it's important that I do bring that up because I don't want to be inherently completely biased based off of the study.
Totally. And I think, this is our like break for the public service announcement for all body parts of like, if you've been, blamed, shamed, insulted, made fun of for your body part in the past, like, it doesn't mean like, I saw a lady, what I'm trying to say is like, I saw a lady, she was in her like 60s. I was going to do an exam and she's like, I'm so sorry for like how it is down there. It's just really ugly and bad and blah, blah. And I'm like, always curious. I'm like, where'd that come from? Right. And she's like, oh, my ex-husband. And I'm like, well, I've seen more vulvas than like most all humans. And I'm like, I'll just put you on the bell curve. Right. And I'm like, you're totally normal. Right. But we carry this. And it's like my public service announcement, I think you agree, is like, you're allowed to let that stuff go.
Absolutely.
Like, that was, somebody said something once because they had their own insecurity or they just wanted to make you feel bad. But like, you probably have a normal penis and you probably have a normal vulva.
Yeah, I think that's a really wonderful point because we do have this, and I do kid around about it sometimes, like, and you said it yourself, like we see more penises and vaginas than virtually anyone around. So, like everyone comes to us and they have their insecurities because they don't, realistically, you're just not going to see as many as we do. And that's, I mean, if you do, God bless, whatever, enjoy yourself. But at the end of the day, like, we do have that unique experience, a way to guide people and say, this is normal. Because I hear it for penises all the time. You hear it for vulvas all the time. Like it's just this inherent insecurity that maybe something was said one time and you just let it linger with you. But at the end of the day, you're right. It is important. People body shame for whatever reason, but you can let it go because most of the time it's not true.
And carrying it forward can affect your current sex life. Right?
Absolutely.
And like, so being able to deal with that. So help us out. You're a perfect person to ask. I've got this partner and he's got erectile dysfunction and he won't talk to me about it. I want to get him to see the doctor because I'm kind of worried about his heart and like, but he will not talk about it. He shuts it down every time I try to bring it up. Like these women are like, what are we supposed to do? Like,
Yeah.
we care, and he is not even coming to the table to have this conversation. And I've tried multiple times. Like, I hear this not infrequently. What would your tips for these people be?
That's a really, really good question because um, I think the best way to get to some of these people is kind of just I mean, it's kind of hard because I think guys, even though they may shut it down, some of them react differently, different ways, right? Some of them will close out and just be kind of more, quiet. Some will be can be, loud and, fight back or whatever. Not necessarily abusive, but can be very confrontational about it. I do think that the most important thing you can say is, half the time is don't worry about it unless not in terms of like, not that it's not a big deal, I think is somewhat of a good way to kind of get someone thinking about that. It's like not to freak out about. But I do think that at the end of the day is I think you've ooh, this is hard. I'm trying to figure this out
So
because
I'm
usually
actually so glad I stumped you. I'm like, oh, I didn't know it was possible.
because the thing is, yeah, because the thing is usually they're in my usually a lot of guys find self-motivation. They do find self-motivation. And I think that if you can, the way that I think guys think is if you can find a way to make it seem like it's his idea, maybe it's even a better idea, and maybe that'll get him in. But I do think that when you're talking about your goals with your partner, if you're struggling in the bedroom, and maybe you can just say, this is what I want out of my sexual experience. What are you trying to get out of your experience? And maybe not right after it happens, maybe before something happens, or just talking about it. In that regard, I think maybe you can kind of find a middle ground. I think that if you see that your partner is having other issues, they're a smoker, they're obese, you can start off with those things because obviously the other stuff, your sexual health is health, and as we've clearly seen through our conversation today, all of these other health factors directly impact your sexual health. So maybe getting him in to get checked for his diabetes or his high blood pressure or his overweight or just an annual checkup will get his doctor talking about it and get him talking about it. So maybe indirectly you can get there. I think it's just hard because every relationship is so different, and I don't think there's a one size fits all for this answer, because I think in some situations, just saying, "Hey, you need help? Go to the doctor. Let's get this fixed together. I'll go with you," is the answer, right? And sometimes it's, "Hey, I don't know if you have a problem. Maybe we should just talk about it together. I'm happy to go to the doctor, and then you can go to your doctor, and we'll both make sure that we're okay." That's a less, aggressive way of doing it. But I think at the end of the day, you kind of have to know your partner. There's a lot of different ways to do it. If you're struggling, maybe some of your friends, listen, everyone, all the guys have, like everyone, you can hear the stats. Guys have erectile dysfunction. Maybe your good friend's husband has erectile dysfunction, and maybe your friend will talk to them, and maybe somehow it comes up, and maybe your friend's friend tells them about this great medication that they took once, and now they're living like they're 25 again. So you did stump me, but I'm trying to give you some kind of different outlets here.
I love it. Yeah, I think, we do such a crappy job of sex education in this
Yes.
country / in this world. And people don't talk about sex when it's going well, right? So we don't talk about
Absolutely.
sex. It's going great, but like, what's an ideal number for you? It's going great, but like, how do you really like to orgasm? Like, the conversation that can happen when it's going well sets you up for the conversation of when it's going shitty. And inevitably, it's gonna go shitty. Like, just plan on it.
Absolutely.
Like, you're going to have a baby. You're going to be breastfeeding. You're going to get low testosterone. Somebody's going to get cancer. You're going to have, kids are going to be stressing you out. Whatever. Like, just plan on it going shitty if that gives you motivation to talk about it when it's going well, because then it helps for when it's going shitty.
I think that is an awesome, awesome recommendation. Great advice.
Ah,
It's all
I love
about
it.
communication. It really is.
It's
At the end of
all
the day,
about
any
communication.
relationship, any situation in a relationship, whether it's sex, you know, money, work, you know, just living, it's all about communication. And why is sex any different? You know, it shouldn't be.
I know. It's so easy for us to say because we look at like 15 genitals a day. We're like, it's just sex. And like realize like it took us a lot of years to get this, at least for me, it took me a lot of years to be able to like have a podcast about sex. Like, right? And I'm like, just talk about sex. Like it's your hobby.
Yeah, no, I mean, listen, I just like on that note, like I do a genital exam like 20 times a day. And every time it's a new patient, most of the time they're like completely taken aback that I'm touching their genitals. And I say, hey, listen, I know this is new for you. It's not new for me. Don't worry. I've done this a million times. Like, I understand this is uncomfortable. It'll be done quickly. But, you know, we forget. I literally do, I do it every day. And, you know, it's just another thing. But, you know, this is people's sexual organs, it's their genitals. And, usually very few people see them or engage with them or touch them. So, you know, I think we are very lucky in that regards for that people to trust us with these very intimate conversations. And I think you agree that's one of the best parts of this job is that we get to hear stuff that, you know, they wouldn't tell their brother, their sister, their mother, their best friend. And we're here and they're disclosing that to us because they know that we can help them. And that's what I tell every single guy. Listen, it sucks to talk about these things. It's not fun to acknowledge these things. But if you don't talk about it and you don't come in and you don't acknowledge the problems, how can we fix problems that we don't know about? We can't. So, you know, it's just really important whether you're a penis owner, vulva owner, you go talk with your doctor with any issues that you may have, because otherwise we're just not going to be able to help you.
Hope is not a treatment plan, people. So I have like these amazing questions I want to ask you. We'll keep it somewhat short for the people who don't want 4-hour podcasts. What's with the products online that say they're going to make you have more semen or different flavored semen? What's up with that? I need your hot take.
So my hot take is I don't think any of them are worth anything. Truthfully, there's no good data on any of these things. You know, it's all theoretical why pineapple makes your semen taste sweeter. You know, it's all theoretical. How to, like, you know, one of the most common questions I get from guys is, hey, my semen is like yellow one day, it's clear the other day. Why? And my answer is, I don't know. Could be diet. Could be, you know, sometimes you're dehydrated. Maybe you're drinking a little bit more water. Maybe you haven't ejaculated in 4 days, and last time you ejaculated was a day and a half between. So there's so many different factors involved that I don't really think that, you know, these supplements are going to do anything. Can they potentially do something? Sure, maybe. But I mean, I think if you're really concerned about these things, maybe you're on a medication like Flomax or something that's causing retrograde ejaculation where your semen volume has decreased. Maybe there's other things going on. Maybe you have diabetes and your semen volume is decreasing because you're also getting retrograde ejaculation because you have nerve issues. But, you know, there's other things at play that maybe before buying a supplement, go talk to your doctor about it, and then I can see if there's something else going on.
Thank you. Thank you for helping all the people save their money. What's with penis enlarging procedures? I'm starting to see like they were big when I was in residency. They were big. They fell off. I didn't hear about them for like a while, and now they're coming back again. Like,
it's
what's
an appropriate name for falling off because that's what I think a bad penis enlargement surgery can do.
God, buyer beware.
Yeah, I am not a believer in doing those kinds of surgeries. I do think they exist. I don't think that they're a good option. There are newer things like injections that can cause increased girth of your penis. But overall, I really think that the risk is way greater than the reward in these situations, because often you do see if something goes wrong, and that's the ironic thing, if something goes wrong, whether it's an infection, scarring, guess what's going to happen? Your penis is actually going to shrink. It's going to be smaller than it was before the surgery. So I really don't think it's it's worth it. It's all cash. You're going to be spending money. And you're really putting your sexual, not only your penis size, it can compromise the nerves. It can compromise your erections. It can do so many things that I really just don't think it's worth it. I think, part of being you is, accepting yourself and your body. There's things we can do and there's things we could do and maybe things we shouldn't do. And maybe this is one of those things I don't think you should do.
I love your forthrightness with it. Somebody had asked to come on my podcast, and I checked them out on their internet, and it was girthy injections, and I'm like, hell no. I think they're preying to men's insecurities. Number one. Number two, these are men that probably don't actually know if they have a female partner, what their female partner actually wants to have an orgasm. It's not a girthier ridge or whatever it is, and it's lack of education, self-image, body stuff, ignorance, and they're just taking their money. So to me, I'm until I see, the AUA or somebody legit being no, this is legit. I'm buyer beware.
I agree 100%.
Okay, so
don't put that by me.
don't put that stuff in your penis.
Nope.
Don't do it. So you did a paper on the inaccuracies of social media, and one of the thing the thing that you found on it was this damn myth of sperm retention.
Yeah.
Not the health benefits of not ejaculating, basically.
Correct.
Where did that come from, and why won't it die?
We're talking about semen retention. So we did this paper. We looked at men's health topics in TikTok and Instagram. We did a content analysis. Basically, we looked at 6 topics of men's health, and we looked at the top posts. We saw whether they were educational, who they were by, and whether we read through them and gave them an accuracy score. And basically, we found that by far the most popular topic on TikTok and Instagram was something called semen retention, with over 1.2 billion with a B views on TikTok and over 1 million posts on Instagram, which is crazy. So and also, before we get into it, all of it was completely inaccurate. It was the most inaccurate posts. There was no accurate information. Not one healthcare provider was discussing these topics. It was all just random people who were discussing this thing. So what is semen retention? Semen retention it's kind of an ancient concept originally. It's kind of like the word's leaving me. What's the Karma Sutra kind of thing, where it was a sexual practice that actually was not meant in any malignancy, right? You could have a sexual practice. It was orgasming without ejaculating. And then at some point, it started turning into this idea that your ejaculate, when you ejaculate, your seed leaves you, your strength, your testosterone, your muscle, your whole masculinity leaves you. And I don't know when that turning point happened. It probably happened in the last 5-10 years. And it became this kind of movement. And at the same time, this other similar movement called NoFap, which is similar in that it does practice the idea of semen retention. However, it focuses more of an anti-porn idea of anti-masturbation. And it's kind of I would say, a direct response to people who claim to be addicted to porn. Now, can you be addicted to porn? Absolutely. I'm not saying you can't. It's a thing. But I think that there is a huge gap in understanding of knowledge and identifying who it truly is and how you have these issues and how you respond appropriately. But at the end of the day, these two movements both claim that retaining your seed, or by not ejaculating, will increase your testosterone, increase improve your skin, improve your hair, make you focus better, make you be more desirable. And quite simply, it's all complete BS. There's no data supporting this. If you think from physiological standpoint, it really doesn't even make sense because, simple puberty. What happens during puberty to men when their testosterone goes up naturally? What happens to their skin if we're talking about skin?
Gets a little rough.
They get acne. So,
they hate it.
and that's something that I always ask my patients when I put them on testosterone, did you develop any acne? So the fact that your skin's improving by retaining your seed and your testosterone is going, it makes zero sense. Okay. It makes absolutely no sense. Your skin's not going to get better. And there's really no data to support this. The problem is though, that people are watching it and they're practicing and I think it's okay if you don't want to ejaculate all the time, that's fine. But if you're trying to do it with a goal of, self-improvement, I don't think that that's the right way to do it. Your sexual health and your sexual activity is whatever you want. I'm not telling you you need to masturbate, you need to have sex. You can do whatever makes you happy. But to do something thinking that there's going to be an improved outcome, that just isn't there. That's just important for people to know.
Perfect.
Yeah, I am a very strong anti-semen retention person.
Just because it's pointless mumbo jumbo. Not because it's
Correct.
dangerous, but it's just mumbo. Are people just going to have nocturnal ejaculate when they're
Some
asleep?
guys have nocturnal emissions, but the other thing is like it is interesting because more frequent ejaculations actually improves your fertility. So if you're trying to have a kid and you're holding off from ejaculating until like the time of ovulation, you're actually not giving your sperm the best shot, right? Your quality of sperm is not that great. We usually recommend guys who are trying to have family planning with their partner to ejaculate either every day or every other day. And there has been known studies to show the benefit of your sperm parameters for that frequent ejaculation. So withholding actually can compromise your sperm quality, if anything. But I don't think most of these guys.
Older? Are your sperm just older?
It's really just kind of sitting there. It is kind of just sitting there.
Yep.
And you're not literally cleaning the pipes,
Yep.
But I think the important thing here is understanding misinformation. We've established that everyone's going online. They're all looking for their health information, whether it's a man, woman, however you identify, but you want to learn more about yourself. And that's okay. I think I always encourage people to try and research, but I think that you have to understand when you're going on social media and on these platforms, like what you're looking at. And I think when you're looking, you want to ask yourself a few questions. One, you want to say, what is my goal? What am I trying to learn from whatever topic I'm searching about myself? Am I trying to figure out an intervention? Am I trying to learn more about the topic? What am I trying to learn? Two, who am I learning from? Who is on this video? And like I said, most of the men's health topics that we saw were not healthcare providers, and that information was terrible. The healthcare providers that we saw gave excellent information in general. So, when you're looking for these topics online and you're on social media, you're on TikTok, should you be listening to an 18-year-old kid who tells you he hasn't jerked off in 3 weeks and he's living his best life? Or should you listen to a physician who's saying, you should probably, go get your blood pressure checked or something. It sounds funny saying it out loud, but people are doing it, right? Like this is what I'm seeing. People are doing it. So you have to ask what you want to learn, who are you learning from? And then three, like, what are you going to do with that information? Are you going to follow that information blindly? Are you going to go talk with your doctor about it? How trustworthy do you feel about this? Is it something you can do, just a lifestyle change that isn't going to impact you like your other things? So there's a lot of different things to consider when you're approaching information online. And that's how I recommend people look at it, because it's easy to get caught up in like the scrolling and the looking. But if you can take a step back and say, like, what am I actually looking at and what is going on here? Sometimes it comes a little clearer. That's
such good wisdom. I have two final questions because people need to know this. Does ejaculating decrease your risk of prostate cancer? Sub question on that. Link between vasectomy and prostate cancer.
All right. So we were talking about this before. So that is a great question. So there was a study that came out a few years ago showing that 21 ejaculations or more a month decreases your risk of prostate cancer. I think I don't have the exact number in my head because I don't have the study in me, but it was some kind of decrease that I don't think it was statistically significant. But at the end of the day, the bottom line is this, you should not be ejaculating 21 times a month or more unless you want to. because at the end of the day, that is not going to prevent you from getting prostate cancer or not. There's so many other factors involved, genetics, family history, smoking, there's just so many different things going on that, will that one thing save you from getting prostate cancer? A, probably not. In fact, I would almost guarantee not. And then B, we'll never be able to prove it either way. So if you're stressing out there, you're saying, I need to ejaculate 21 times a month because I'm going to be cancer free. I mean, just don't do it, because it's just going to increase more stress in your life. If you're ejaculating more than 21 times a month anyway, just go enjoy yourself. But that should never be your goal, because it's all relative. And although there's data to support it, you have to understand, the relative risk that we say, and really the relative impact on this is really negligible.
Beautiful.
And then vasectomy, you said, right? So yeah, the data is very good here, that we know that vasectomy does not cause prostate cancer. There's a lot of other things that guys often ask about vasectomy. It does not compromise your orgasm. It does not compromise your erections. It does not compromise your testosterone levels. Your semen volume, it does not compromise either. Your sperm is about 5 to 10% of your full semen volume. So you're really going to be the same. At the end of the day, what I tell my patients and what guys need to know is a vasectomy does not change anything except for your fertility. And that's it. You're going to be shooting blanks. Everything else is going to be the same. It's a beautiful procedure that we highly recommend for all men who are not interested in having any further kids or kids at all. It's a great procedure, and it takes a huge burden off of your partner in terms of, not having to take medications. Tube tied is a much more invasive procedure than a vasectomy as well.
Yeah, the last stats I saw on that, 4 people die a year from getting their tubes tied in America. 0 people die of getting a vasectomy.
That's a crazy statistic. 4 people is way too many. That's insane.
4 people is too many. I agree.
Way too many.
Dr. Justin Dubin, thank you for joining me. This was an amazing podcast episode. You guys,
this was so much fun.
This is so much fun. When you get 2 physician podcasters together, they have fun.
I agree. And we're excited to have you on our podcast too. So you're going to be coming on ours too.
I'll share that for my people. And your podcast is called Man Up, A Doctor's Guide to Men's Health. Check it out. They've been out for a year. It's good stuff. For your other half.
Thank you.
Awesome. Thank you so much.
Thank you, guys. Thanks, Kelly. Appreciate it.